Welcome to the deep dive. Today we're tackling osteoarthritis of the hip. It's something a lot of people know about or know someone who has it.
Yeah, exactly. And
Yeah.
we're going to, break down some key revision notes on it.
Right. Usually we pull from lots of sources, but today it's really focused on these notes to give you that clear, high-yield understanding for study or just general knowledge.
Yep. The mission is clarity on hip OA, the essentials you need.
Okay, let's start with the basics then. What exactly is osteoarthritis of the hip?
So fundamentally, it's a degenerative joint disease,
Degenerative meaning.
meaning it involves the breakdown of the joint tissues,
Yeah.
specifically the cartilage that cushion between the bones in the hip and the underlying bone itself start to wear down over time.
And that leads to the problems people feel.
Precisely. Hip pain, stiffness, finding it harder to move.
Hmm.
Those are the classic consequences.
Okay, so what causes this wear and tear?
Well, it's usually a mix of factors. There's definitely genetic components. Some people are just more predisposed. Then there are mechanical influences, like how the joint's been used or loaded over the years. And of course, age-related changes play a significant role.
So it's not just one thing.
Not usually, no. The exact trigger isn't always fully understood, which keeps it interesting from a research perspective.
Right. Who tends to be more at risk then? Are there clear groups?
Yeah, there are. We actually use in mnemonics sometimes a GO-JO.
The GO-JO? Okay, break that down.
Sure. A is for advanced age. It gets much more common as we get older. G for genetic predisposition, like we mentioned.
Okay.
O is for obesity. Extra weight puts more stress on the hips. And the final JO stands for joint outcomes, meaning things like previous joint injuries.
Ah, okay. A GO-JO. Simple enough.
And we also know it's generally more common in females. Certain occupations involving heavy lifting or repetitive stress on the hips are risk factors too. Oh, and pre-existing joint deformities.
Got it. So physiologically, what's happening inside the joint?
The core issue is that gradual loss of cartilage. You lose that smooth protective layer. Then you start getting bone rubbing against bone, that bone-on-bone friction people talk about. It's painful, obviously.
Ouch. Yeah.
The body might also try to compensate by forming little bony growths called bone spurs or osteophytes around the joint. And inflammation often plays a part in the pain and stiffness too.
Makes sense. If someone comes in with hip pain, though, how do you know for sure it's OA? What else could it be?
Good question. That's where differential diagnosis comes in. We need to rule out other possibilities.
Like what?
Things like rheumatoid arthritis, which is more of an autoimmune inflammatory condition, a vascular necrosis, that's where the bone tissue dies due to lack of blood supply.
Okay.
Also, labral tears, damage to the cartilage ring around the hip socket, and just, other hip joint disorders. Getting the right diagnosis is key.
Absolutely. How common is hip OA here in the UK?
It's very prevalent, primarily affects adults over 50. The stats suggest around 8 to 10% of people age 45 and over the UK are affected.
Wow, 8 to 10%. That's quite significant.
It really is. It has a major impact on a lot of people's lives.
So what are the specific signs and symptoms someone might notice building up?
Well, the pain is usually gradual in onset, often described as a deep ache in the groin, buttock, or thigh. Stiffness is common too, especially in the morning or after sitting for a while.
And does activity affect it?
Typically, yes. The pain often worsens with activity like walking or standing, but tends to improve with rest. And people notice a reduced range of motion in the hip.
Anything else on examination?
You might find tenderness when pressing around the joint, sometimes a bit of swelling, a clicking or grinding sound that's called crepitus. People might develop a limp.
Right.
And just difficulty with everyday things, putting on socks, getting in and out of a car. Muscle weakness around the hip can develop too.
Okay. So if you suspect OA, what tests do you use to confirm?
X-rays are usually the first step. They're great for visualizing the joint space narrowing, seeing those bone spurs and other bony changes.
Pretty standard then.
Yeah. An MRI isn't always needed, but gives much more detail on soft tissues like cartilage and the labrum if there's uncertainty. Blood tests are mainly done to rule out other conditions, like rheumatoid arthritis.
And what about joint fluid analysis?
That's done much less commonly for OA, more useful if you suspect infection or crystal arthropathy like gout.
Right. So once diagnosed, how is hip OA managed in the UK? What are the options?
It's usually a multi-pronged approach. Lifestyle changes are key. Weight management, if needed, is really important.
Makes sense. Less load on the joint.
Exactly. Physical therapy is crucial exercises to strengthen the muscles around the hip and maintain flexibility.
What about pain relief?
Simple painkillers like acetaminophen or paracetamol are often tried first. Non-steroidal anti-inflammatories, NSAIDs, can help too, but you need to consider side effects.
Hmm.
For more localized relief, corticosteroid injections directly into the joint can sometimes provide temporary benefit.
Temporary. Okay.
And using assistive devices like a cane or walker can help with mobility and reduce load.
And surgery.
Surgery, specifically hip replacement, is usually reserved for severe cases where pain and disability are significant and haven't responded to other treatments.
Okay. What's the general outlook, the prognosis for someone with hip OA?
It tends to be a slowly progressive condition. It generally worsens over time, but the speed varies a lot between individuals.
But management helps.
Yes, early intervention and consistent management can significantly help control symptoms and maintain function for longer. But the underlying joint damage itself is generally considered irreversible.
Right. Are there any specific complications to be aware of?
Definitely. The main ones are reduced quality of life because of the pain and limitations. Over time, you can get joint deformity and muscle atrophy or wasting.
Okay.
There's also an increased risk of falls and fractures, partly due to the pain, weakness, and changes in gait. And as we mentioned, the potential need for hip replacement surgery down the line is a major consideration.
So just to quickly recap, hip OA is that common degenerative joint issue causing pain, stiffness, reduced movement, influenced by age, genetics, obesity, past injuries, remember, a GOJO.
Yep.
It involves cartilage loss leading to bone-on-bone friction, maybe bone spurs. Diagnosis uses x-rays mainly. Management is layered lifestyle, physio, pain relief, maybe injections or surgery.
Exactly. It progresses slowly, management helps symptoms, but complications like reduced quality of life and falls are risks.
It really makes you think, doesn't it? Considering how prevalent it is, what sort of simple, proactive lifestyle things could people maybe consider just to support their general joint health long term?
That's a great takeaway question. It's
Yeah,
definitely something for everyone to consider.
For listeners wanting to dive deeper or need solid revision resources, do check out pastthemsra.com and also freemsra.com.
Great resources.
Thanks for joining us for this deep dive.